Do you have pain shooting down your leg? Does the back of your leg feel like it's being torn apart? Then you may have sciatica. But what causes this pain, and how do you avoid sciatica flare-ups? And how can you further prevent lower back and leg pain? What is sciatica? Sciatica is a symptom that includes leg pains, muscle cramping in the leg or back, pain radiating down the leg, discomfort sitting or standing for long, weakness, numbness, or tingling in the leg, loss of mobility in the knee, ankle, or hip. When the sciatic nerve becomes pinched, it creates sciatica symptoms. Since the sciatic nerve is responsible for leg mobility, when it gets pinched, it will create the previously mentioned symptoms. Specific conditions can pinch a sciatic nerve, such as a herniated, ruptured, or slipped disc, tight muscle in the buttocks, spinal stenosis. This is a narrowing of the spinal canal. Spondylolisthesis, or when spinal vertebrae are out of alignment with another. How do you know if you have sciatica? Unfortunately, without a proper examination by a medical professional, you can only guess what's the matter. Consult your family doctor if you experience any symptoms resembling sciatica for longer than 24 hours. Most likely, your family doctor will refer you to an orthopedic specialist who can better diagnose your condition. Most likely, you'll have to get an MRI or magnetic resonance imaging for a deeper look into your body. An MRI can uncover what the true extent of the sciatic nerve damage. What should you do when you have a sciatica flare-up? In a perfect world, you'll consult your physician first when you experience pain. Serious, this is not something to play around with or wait to get better. When I had a sciatic nerve pain, I would sit down or rest for 15 minutes, place a cold compress on my low back, and in some cases, place a heating pad on the tight leg muscle, but I never put heat on a leg with tingles, numbness, or extreme pain. Under no circumstance would I ever exercise. This includes walking, running, or even standing. Place heat on my low back since it only aggravates the inflamed nerve. Ice the affected area for longer than 15 minutes at a time. Too much icing isn't any more effective. Stretch. I know this seems counterintuitive, but if a nerve is excited, then no amount of stretching will alleviate the pain. Calm the nerve first, then stretch. What options are there for sciatica treatment? Most of the time, the first option for sciatica treatment is physical therapy. Physical therapy is a great way to retrain the body to perform better and heal on its own in the process. If physical therapy doesn't work, then the next options may include spinal injections or epidural steroid injections. This worked for me, but it had short-lived results. Getting injections was painful and I had diminishing returns with each treatment. Spinal surgery, laminotomy or laminectomy. A laminotomy or microdiscectomy is when a portion of herniation is removed to alleviate pressure from the nerve. A laminectomy is a more extreme surgery where a portion of the vertebrae is removed to alleviate pressure. The most severe form of surgery is spinal fusion. That is in worst-case scenarios and requires up to a year of recovery time. Medicines. I believe most pharmaceutical solutions simply mask the problem and don't address the major issue. However, a prescription is 100% necessary for faster recovery. Don't dismiss medication. I caused myself a lot of undue pain by not taking pain relievers and anti-inflammatories. So, what is the best line of defense against sciatica? Proper nutrition and exercise will greatly decrease your likelihood of sciatic pain. Sadly, most people won't know they have an issue until it's too late. Once you get treatment, stick to a regimented workout program and diet. I'm reminded occasionally when I'm slacking on my own workouts and stretching. My sciatica will wake up and quite literally kick me in the butt. If you want to know other possible solutions to your back pain and sciatic issues, then head over to howtorelieve-sciatica-pain-at-home.com. Once again, that's howtorelieve-sciatica-pain-at-home.com. I hope this video has shed light on sciatica so you can take steps towards a pain-free life and overall happiness. Thank you for tuning in, and I look forward to seeing you once again at howtorelieve-sciatica-pain-at-home.com. Take care.